Avast there. It be too late to alter course, mateys, and there be plundering pirates lurking in every cove, waiting to board. Among the sunken ruins of this Spanish galleon, we'll encounter the antibiotic.
Alright, that turned into some kind of weird, like Christopher Lambert Scottish. Anyway, what I was trying to tell you is that this next sketch is going to cover anti-neoplastic antibiotics, including bleomycin, anthracyclines, and actinomycin D. What? Antibiotics? Those kill cancer too? Well, it turns out that scientists have discovered numerous growth-inhibiting compounds produced by microbes that have proved to be clinically useful in cancer chemotherapy. See those tendrils of kelp spiraling their way up to the ocean surface, evoking an image of double helix DNA strands? As you'll soon see, the antibiotic agents we'll encounter skulking around this sunken Spanish galleon directly interact with DNA, either by intercalating between specific bases or by causing strand breaks. Either way, DNA and RNA synthesis is blocked and cell division comes to a halt. Oh, look, it's a beluga whale. Ah, yes. Delphinapterus lucas, a prime specimen, also a perfect representation of our first anti-tumor antibiotic, bleomycin. Bleomycin is a small peptide that has a DNA binding region on one end and an iron binding region on the other. See how this baby bleomycin beluga produces those rising oxide bubbles? After bleomycin binds to DNA, it chelates metal ions, producing a pseudoenzyme that reacts with oxygen to produce superoxide and hydroxide free radicals that cleave DNA. Other mechanisms may also be at work here, but in the end, these reactions cause single and double-stranded breaks in DNA as depicted by this fractured double helix of seaweed. Bleomycin is a cell cycle specific drug. As it turns out, cells become arrested in G2 phase of the cell cycle, hence the galleon wreckage in the back with G2 highlighted specifically. Bleomycin is indicated in the treatment of Hodgkin's and non-Hodgkin's lymphoma, as well as numerous solid tumors such as germ cell tumors and squamous cell carcinoma of the skin, cervix, and vulva. So, as a little reminder, we're talking chemotherapeutic agents here. We've included our cracked cancer crab. Just a quick bite for our blubbery bleomycin beluga buddy. So what's the major dose-limiting toxicity of bleomycin? Pulmonary toxicity as evoked by this infiltrating pulmonary fan coral. Toxicity usually presents as pneumonitis with cough, dyspnea, and inspiratory crackles, as well as pulmonary infiltrates seen on X-ray. In rare cases, pulmonary toxicity can be fatal. Bleomycin is also associated with skin toxicity, which can manifest as rash, exfoliation, or, as seen on our beluga friend here, hyperpigmentation and atrophic striae. And bleomycin also affects the rapidly dividing cells of mucous membranes, causing stomatitis and mucositis. Kind of like the stomatitis induced by this prickly sea urchin. He really should have known better. Oh yeah, and that big bald beluga brow of his? Bleomycin, as well as the rest of the anti-neoplastic antibiotics in this sketch, disrupt hair follicle cells and cause alopecia. Our next antibiotic agents, the anthracyclines, are embodied by the cursed vessel herself, the Santa Anthracycline, an armed Spanish merchant ship, ordered burned and sunk after years of service for the West Indies fleet. It is said, however, that she was resurrected by Davy Jones himself, and can be seen sailing the tide at night, carrying a chest of rubies that curses any who disturb its resting place. Let these rubies remind you of the rubicin suffix common to many of the anthracycline analogs, including doxorubicin and daunorubicin. Anthracyclines are antibiotic agents initially isolated from a species of actinomyces bacteria, and now some of the most widely used cytotoxic anti-cancer drugs. Anthracyclines exert their cytotoxic action through numerous mechanisms. For instance, like bleomycin, they promote the generation of oxygen-free radicals through an iron-dependent reductive process. So again, we've included a few free oxide bubbles rising forth from this cursed chest of doxorubicin rubies. Anthracyclines also demonstrate high-affinity binding to DNA through intercalation. Intercalation just means that these drugs are planar molecules that are able to fit themselves in between base pairs of DNA. Kind of like how these stray doxorubicin rubies fit themselves neatly into the undulating double helices of kelp on the ocean floor. This DNA binding effect causes the blockade of DNA and RNA synthesis, leading to cell death. Doxorubicin specifically is one of the most important cancer drugs in clinical practice, with major clinical activity in numerous solid and hematologic malignancies. Due to their bubbly free radical mechanism, anthracyclines are associated with an irreversible dose-dependent cardiotoxicity secondary to a buildup of free radicals within the myocardium. This manifests as dilated cardiomyopathy, with symptoms of heart failure presenting months after the drug is stopped. So take a look. Not only are the rubicin rubies heart-shaped to remind you of chronic cardiotoxicity, next to our cursed chest lies a few dilated cardiac sacs as well, overflowing with rubies, left behind by the last marauder who fell prey to the treasure's curse. Aye, but there is one pirate still who clutches onto his share of the plunder. That be Jack Marrow, cursed forever to command this wicked ship until the debt is repaid. As he clings, nay, chelates, to his heart-shaped share of the booty, protecting it to his death, think of the cardioprotective drug dexrazoxane, an iron chelating agent currently approved to prevent or reduce anthracycline-induced cardiotoxicity in certain situations. Plus, notice that we've put Jack up on the deck brandishing that razor. That's dexrazoxane, mateys. The main dose-limiting toxicity of all anthracyclines is myelosuppression. So, atop the sunken Santa anthracycline vessel, we've placed a bone-shaped chest, open to reveal its mostly depleted interior. It turns out that bleomycin, in contrast, confers relatively little risk of bone marrow toxicity. Anthracyclines also affect the rapidly dividing cells of the mucous membranes, causing stomatitis and mucositis. So remember that prickly sea urchin. You can touch it, just don't put it in your mouth. Oh yeah, and that bony chrome dome of his? Like bleomycin, the anthracyclines disrupt hair follicle cells and cause alopecia. The last anti-tumor antibiotic we'll encounter on this swashbuckling adventure is actinomycin D. Think actinomycin, artifactinomycin, as in these artifacts here left behind by the travelers on board this doomed Spanish galleon. See how the artifacts are strewn throughout the seaweed below, inserted into the spiraling double helices? Like anthracyclines, actinomycin D binds to DNA and acts as an intercalating agent. In other words, this drug consists of planar molecules that are able to fit themselves in between base pairs of DNA. This DNA binding effect causes the blockade of DNA and RNA synthesis, leading to cell death. Actinomycin D has special use in numerous pediatric malignancies, including Wilms tumor, Ewing sarcoma, and rhabdomyosarcoma. So, to remind you of childhood tumors specifically, the main artifact in view is this childhood doll, now just a forgotten relic from the golden age of piracy. The sparse hair should remind you of alopecia, a common toxic effect of all the anti-tumor antibiotics in this sketch. Also, just like with the anthracyclines, significant myelosuppression can occur, requiring that hematologic indices be carefully monitored during therapy.
Aye, mark well me words, mateys. Dead marrow tell no